Thank you so much for coming out. And in representation of Ed Town's office, we have Gail Mohammed. Welcome, Gail.
Good evening, everyone. I'm Gail Mohammed, Special Assistant to the Honorable U.S. Congressman Ed Towns. The Congressman could not be here tonight because of scheduled votes in Washington, D.C. in the U.S. House of Representatives. I am here to read the following statement on his behalf. Health care will touch every American at some point in his or her life. When that time comes, I believe that it's important for people to have a choice in their health care provider in order to assure high quality care. That is why I am strongly committed to a robust public option that makes good on America's promise for equality for all Americans, and that includes equality in health care. This struggle resonates all over America. In Kings County, there are 300,000 uninsured residents who grapple with the rising cost of health care and high health care premiums. We cannot afford to sit idly by and let this unique opportunity for comprehensive reform pass us by. I am reminded of the words of Martin Luther King Jr., who said, "I can never become what I ought to be until you become what you ought to be." I cannot appreciate my health insurance until every single American has quality health insurance. U.S. Representative Adolphus Ed Towns, Member of Congress, New York 10th Congressional District. And thank you.
All right, thank you, Gail Mohammed, and thank you to the Representative Ed Towns. Daniel Wiley, has Daniel Wiley arrived? No? All right, I have a statement here from Yvette Clark's office. Let me read this to you. Excuse me. Healthcare is a fundamental human right rather than a commodity. A year ago, Americans cast a historic vote to change the course of this nation. Today, we cast a historic vote to finally manifest the change they demanded: access to affordable health care. We're being watched. I am proud to cast my vote in favor of this bill. This bill provides health care coverage to 96% of Americans and includes a strong public option that will provide the needed competition to lower premium costs. In my district, the 11th Congressional District of Brooklyn, the Affordable Health Care for America Act will, first, improve employer-based coverage for 367,000 residents. As a result of the insurance reforms in the bill, there will be no co-pays or deductibles for preventive care. No more rate increases for coverage denials for pre-existing conditions based on gender or occupation, and guaranteed oral, vision, and hearing benefits for children. Second, it will provide credits to help pay for coverage for up to 160,000 households if they need to purchase their own coverage. Third, under the bill's insurance reforms, 11,900 individuals in the district who have pre-existing medical conditions will now be able to purchase affordable care. And finally, this bill will allow 11,300 small businesses to obtain affordable health care coverage and provide tax credits to help reduce health insurance costs for up to 11,400 small businesses. This indeed is a historic day. As the legislative process continues, I am confident that the final version of the health care reform bill will retain a strong public option. While we have come a long way, the fight is not over. There are still those who want to stand in the way of progress. That is why I am continuing to issue a call to action. As supporters of healthcare reform, you must mobilize by contacting your elected officials and demanding action. Call your friends and family in other states and tell them to do so as well. Let the whole country know that you support comprehensive healthcare reform. It's now or never, because we'll never get an opportunity like this again in our lifetime. That is from the office of our representative, Yvette Clark. Yay! All right. We also have, in this big fight, we have the assistance of a great organization of 45,000 doctors, something like that. Approximately that many doctors working across the country with the organization, the National Physicians Alliance. And with us tonight, representing the National Physicians Alliance, we have Dr. Rafi Pristoop. Thank you, Doctor.
Hi, I'm Dr. Pristoop. My friends call me Rafi. I applaud everyone for coming out tonight because it's really cold. I'm an internal medicine attending physician at Kings County Hospital. It's in central Brooklyn, and Kings County is a public hospital. So we get a lot of patients who are uninsured. And that makes me on the front lines day in and day out of healthcare in America. And our hospital is overworked and overcrowded with patients. Last week I was working at our walk-in clinic. If you've ever been to the DMV in Brooklyn, it's much worse. The waiting room is overcrowded, people are screaming, and the waits are hours. Last Monday morning, I'm only supposed to see 15 patients in the morning between 8:30 and 12. I saw 28 patients and I turned more away. And I can tell you that what I see on a daily basis is patients who don't have insurance do much worse than patients with insurance. You already heard the statistic tonight, 45,000 people die each year just because they don't have insurance. Not having insurance is a huge deterrent to seeking and receiving medical attention. If you don't have insurance, it's a scary thing to go to a doctor because you will be charged very high bills. And so people wait. When they feel a little pain, they wait. They put it off for months. This week, I diagnosed, I'm not making this up, just this week, 3 newly diagnosed metastatic cancers that could have been detected earlier and treated with a better prognosis. There's easily treatable diseases, for example, diabetes, that I see on a daily basis. You can treat them with a pill. If you have insurance, you go to your doctor, you get a pill, you get follow-up, you're treated easily. If you don't have insurance, you don't go to your doctor enough. You have to pay for medicines. You don't have enough money to pay for the medicines. The disease progresses to the end stage. You get end-stage kidney disease on dialysis. You go blind. You need amputations. You die earlier of heart attacks and strokes because you don't have insurance. I see this. In every other industrialized democracy in the world, every citizen has insurance. In America, that's not the case. That's my statements about the uninsured. Now let me say some things about people who actually do have insurance. My colleagues, my fellow doctors, we're all sick of being told how to treat our own patients. We know what's best for our patients and we want to treat the patients the way we decide. But we're told what we can and cannot do for our patients by private insurance companies. We're told what drugs we can and we cannot prescribe. We're told what treatments we can and cannot prescribe. We often spend more time on the telephone arguing with insurance companies to get the needed treatments that we want than spending actual time in the examining room with our patients.